Okay, so since it's 9 o'clock, why don't we, if it's okay with you, Ashley, why don't we go ahead and get started and we'll um, get the recording started. And then if people join, they can just join in. But then since it's recorded, we'll make sure that they get that as well if they join late.
Definitely.
Okay, awesome. All right, Victoria, if you wouldn't mind getting the recording started, I'd appreciate it. And okay, so, well, thank you so much, everyone. Good morning. My name is Rachel Ruddock, and I'm the workforce at the Michigan Center for Rural Health. So I'm pleased to be here this morning with all of you to discuss provider loan repayment programs that are available. If at any point during today's discussion, if you have any questions, this is pretty informal, so feel free to just, jump in with your question. We don't have to wait until the end because I don't want you to forget your question. So feel free to just ask away, and then we'll just proceed on to the next topic. So before we start discussing the loan repayment programs, I wanted to give you some background about the Michigan Center for Rural Health. I think some of you might be familiar with our organization and some of you may not. So we are a nonprofit organization and we're the designated office of rural health for Michigan. And as such, we serve as the point of contact for rural health issues and initiatives across the state. We advocate for rural health care and for communities. And as such, we work very closely with our partners at the state and federal level. And we also work with the EMS agencies, rural health clinics, community health centers, and the hospitals that are located in all 57 rural counties. And as a side note that's relevant to your group, we are the recipient of an RCOR grant as well. So we received an RCOR planning grant the very first year that the RCOR funding was released. So I believe, if I'm recalling correctly, I believe it was at least almost 3 years ago now. And that grant focuses on the northeast section of the Lower Peninsula. And with that planning grant, we formed the Northern Michigan Opioid Response Consortium, so NMORC. And we also were the recipients of the implementation award. So we have staff, we have an NMORC team on our staff, a project director, a few project associates, an AmeriCorps member, and a part-time medical director who lead all of the NMORC work. So just wanted to let you guys know that we are, as the Michigan Center for Rural Health, we are heavily involved in the RCOR work ourselves and also familiar with the grant requirements and everything that you all are participating in as well. So when we think of rural Michigan, I like this map because I'm a visual person, and I think it also helps folks to see that all the yellow counties on this map are designated rural by the federal government. So as you can see, Michigan, we have 83 counties and roughly 57 of them are designated as rural. Obviously, Huron, Tuscola, Sanilac, and I'm sure you're all aware, are designated as rural counties. But then, all of Northern Michigan, really, the UP, Southern Michigan, also are considered rural by the federal government. So it's really a huge geographic swath of our state when you really look at the map this way. So how can I help you? How can I help your consortium or even your individual organizations? So as a workforce development manager, I'm involved in providing a lot of technical assistance on a variety of topics. So that includes loan repayment programs, which we're going to talk about today, health professional shortage areas, so HPSAs, those designations, J1 visa waiver programs. So the J1 programs, those are for physicians who are not from the United States, but maybe they came here for either medical school or residency, and they have to complete immigration requirements and obtain a waiver in order to stay here in the United States and practice. Also can help with other workforce development programs, ideas that you may have. Really, I'm available for whatever it is that you need as it relates to workforce. Any questions you might have, there is no question that's too small or too big. The great benefit of us being the State Office of Rural Health is that we do have connections with obviously folks at the state as well as at the federal level, great relationships with our fellow organizations and associations throughout the state. And then we have very close contact and relationships with other state offices of rural health throughout the United States. So we have lots of avenues in which to try to find answers or solutions for you for whatever that may be. And then we're going to talk about 3RNet, which is the National Rural Recruitment and Retention Network. I'll talk about that a little bit later on in this presentation, but I can help you with posting your positions on 3RNet and help you with the usage of 3RNet. And then also with the evaluation of your workforce related activities. So specifically as it relates to your implementation award, if there's something related to workforce that you have some questions on, whether it may be some data collection or whatever it is that you wrote to in your implementation grant, I would be happy to take a look at that and see how I can help in any way, help you accomplish that activity and that goal. So I want to spend a few minutes talking about health professional shortage areas, HPSAs, that's their acronym. I should let you know that, and I believe I've sent this information to Ashlyn. If I haven't, I can make sure to get that to her and she can get it out to all of you. But next Wednesday at 11, it's December 16th at 11 a.m., we are hosting a webinar specifically focused on HPSAs. And our presenter is going to be Miguelina Corella Garcia, and she is the shortage designation analyst for the state of Michigan. So she is our HPSA expert for the state, and she is going to present on HPSAs and talk about them specifically as they pertain to rural Michigan. So I am not the HPSA expert for the state of Michigan, that is Miguelina, but I am immersed in HPSAs as a part of my job, and I do have a pretty good understanding of them. So a lot of organizations and a lot of folks will come to me for help with interpretation of designations or scores or what that means for other programs like the loan repayment programs. But if you really want kind of a more in-depth view and even just a basic overview of what HPSAs are and how they're calculated, I would encourage you to join us for that webinar next week. So HPSAs are designations and scores that are given by the Health Resources Services Administration, federal government, to counties, populations, or facilities that have a shortage of providers. So there's three types of HPSAs or HPSA designations, which are primary medical designations. So a shortage that indicates a shortage of primary care physicians. So HPSAs do not calculate in or factor in nurse practitioners or physician assistants. It's only primary care physicians. Dental, it's obviously dentists. And then mental behavioral health, they look at psychiatrists. So shortage of psychiatrists. So areas can have all three, they can have one, they can have two designations or none. Some areas of the state and areas of the country have no designations. Scores are on a scale of 0 to 26. A higher score indicates a greater need. And the reason why I'm mentioning HPSAs today is because both the federal and state loan repayment programs use HPSAs to determine qualification for loan repayment. So they use HPSA designations as a factor in the qualification for an eligibility for their loan repayment programs. You can find HPSA designations and scores at hpsafind.hrsa.gov. So you would go to this is just a screenshot of what the homepage looks like, but you would go to this website and you would select on the left-hand side, Michigan, and then it will populate all 83 counties, select Sanilac or Tuscola or Huron, and it will populate, if there are any HPSA designations in those counties, it will populate those designations with their scores. It'll tell you what type of HPSA designation it is. There's all kinds of HPSA designations. There's low income, Medicaid, population, geographic. So again, Miguelina on her webinar next week will go into depth on that, but there's all different types of designations. But the important part is just that there is a designation and understanding that there is a designation and what the score is. I should say that this isn't always, it's a federal government website. It's not always the most intuitive. It's not always the most user-friendly, and it's not always the easiest to interpret the results. So if you do look up your county or a county and you get the results, but you don't really understand what it's telling you, again, feel free to email me, reach out to me, and I would be happy to help you interpret that and let you know what it's saying and what that means for whatever your question is. So this map was put together by MDHHS, and the data is from roughly about the end of August. So what this shows, or what this depicts, are the primary care HPSAs in Michigan. So when I look at this map, and hopefully you guys can see the different shades of green on it, when I look at this, I don't necessarily pay that close attention to all of the different shades. I just pay attention to the fact that, look at how much of the state is covered by a primary care HPSA. So how much of the state is a shade of green? If a county or an area is white, then that means that it's not designated. But another interesting thing to kind of look at is if we recall back to the map that I showed at the beginning of the 57 rural counties of the state, when you compare this map to that map, it's very, very similar. So it's very similar in terms of most of rural Michigan is going to have a primary care HPSA designation. That's not 100% true. There are areas, you can see on this map, there are some, parts of rural Michigan that are white, so means that they're not designated. But as a whole, most of rural Michigan is designated. But again, you really want to double check that on the HPSA Find website just to make sure that, your area or whatever the area of interest is actually designated, because you don't want to make an assumption that it is, because sometimes there's some outliers there that, you think for sure they're designated and then you find out they aren't. So you always want to reference back that HPSA Find website. And the important thing to realize with HPSAs and that I always think about when I'm thinking about designations is that I consider HPSAs to be a living thing. So HPSAs are constantly reevaluated. And so that means that just because Huron, Sanilac, and Tuscola have HPSA designations right now, that doesn't necessarily mean that they'll have HPSA designations, a year from now or 5 years from now. Or I've been in my position for 5 years. And I remember when I first started 5 years ago, Huron County didn't have a designation. And now it obviously does. But, that's just an example of how the designations can change. And because HPSAs are so dependent upon data that the state has to collect, it's really important on the local level that if you think something is going on in your community that is going to somehow affect a HPSA designation, it is always worthwhile to let the state know that, because obviously, Miguelina is in Lansing and she doesn't know what's going on in Sandusky or what's going on in Bad Axe. She doesn't have that capability of knowing what's going on the ground there. So if you suddenly see an exodus of primary care physicians, either they're retiring or they're leaving the area to go practice elsewhere, if you see that, then, always feel free to either reach out to me or to reach out to Miguelina and say, hey, I we've got some workforce changes here in the physician realm, and I really think it would be worth maybe a reevaluation of Tuscola County and taking a look at our HIPSA designation and our HIPSA score, because we're losing some physicians, or we're losing some dentists, or whatever that may be. And Miguelina is always happy to do a survey of the providers in that area using some national databases, as well as data that is collected from the practices in that area. And then she's happy to do an analysis of the data. And if the numbers show that, yes, the score should change or the designation should change, then she submits that to the federal government. So we see that happen a lot with a lot of communities, or sometimes it's a hospital, or sometimes it's a clinic, or a health department will reach out to us and say, hey, you guys, there's just a lot that's changing here, and we really think that there should be a reevaluation of the data. And the state is always happy to do that, and I'm always happy to help in that process as well. So switching over to starting to discuss the loan repayment programs. So loan repayment programs, there are federal and state programs that exist for primary care physicians who work in a HIPSA in an outpatient setting. So basically, the federal government and the state of Michigan, because the federal government has said so, has decided through data that there is a shortage of outpatient primary care physicians in the United States. I don't think that's probably not news to any of you. You probably experience that yourselves, this, but that is where the federal government has put their effort forth in terms of loan repayment programs for providers. So these loan repayment programs are only available to primary care physicians or providers. So nurse practitioners, physician assistants, dentists, social workers as well. But in terms of physicians, it is the primary care. So it's not for emergency medicine. It's not for surgery. It's not for cardiology, dermatology, anything else. I call it the ologists, as I refer to them as sometimes, that it is for strictly primary care. That's where the money goes for these programs. And that's really where the focus and the effort on the federal government part, therefore the state of Michigan's part, that's where that goes. So these programs are great because they are state and federal income tax exempt. So any money that a provider or a participant in these programs receives is income tax exempt, which that's a huge bonus for them. And when I refer to primary care, what the federal government defines that as is family, internal, OB-GYN, pediatrics, geriatrics, med peds, and psychiatry. So when I say a primary care provider, they need to be practicing, whether it's a physician, NPPA, they need to be practicing in one of these listed medical specialties that is considered primary care by the federal and state governments. In Michigan, we are very fortunate to have the Michigan State Loan Repayment Program. Not every state has a state loan repayment program. That is not a requirement. The states do not have to have their own loan repayment programs, but Michigan does, and it's a pretty robust program. So we are fortunate in that we do have this available. The state loan repayment programs are in part funded via the National Health Service Corps, which I'll talk about in just a couple of minutes. So they are partially federally funded. So therefore, there are a lot of similarities between many of the state programs and the National Health Service Corps at the federal level, but there are definitely some key differences. And just because a state has a state loan repayment program It does not mean that they look the same. So if you are familiar with the Michigan State Loan Repayment Program, then you are only familiar with the Michigan State Loan Repayment Program. You know, the program in New Mexico looks different than Michigan, which looks different than Washington, which looks different than all the other states. There's lots of states that do things completely differently than the way that we do. And they also even admit different provider groups than we do. Some states allow EMS professionals to be eligible, or other medical specialties that we don't. So it is a very, very state specific thing. But in Michigan, our program is designed specifically for outpatient primary care clinicians who are in full-time 40 hours per week primary care practice. The emphasis for eligibility on this program is placed on the HPSA designation, not the score. So this is a key difference between the state program and the National Health Service Corps, which we'll run over again, we'll review the National Health Service Corps in just a few minutes. But basically what the state of Michigan is saying with this is that if you are an outpatient primary care provider, you must be practicing. It's not living, it's not your headquarters of your employer are based in a HPSA. It is you are practicing. So what is your practice site address, your clinic address, your hospital address, wherever it is that you're practicing, it's your practice site address must be located in a HPSA. They do not care though what that score is. So again, if you recall on the HPSA slide, there's a scale of a score from 0 to 26. So for the state program, you can work at a HPSA with a score of 0. You could work at a HPSA with a score of 26 or anything in between. And the state of Michigan does not care what that score is. You must be a US citizen or national, and you can receive up to $25,000 per year or $200,000 over the course of 8 years. Again, this is completely tax-free dollars, so that's a huge benefit for providers. The other key difference with the state loan repayment program is that the employer is required to contribute a 20% match for each year in which a participant is in the program. So the National Health Service Corps has no matching requirement. The state of Michigan program does. So key difference there. The providers that are in the state loan repayment program, their employers are going to have to contribute some money towards their loan repayment. And you have to contribute, make that match for every provider and for every year in which they are in the program. So that is something to keep in mind if you have providers interested. To make sure to talk to your finance department, obviously, because finance is going to be involved, because they are going to have to write checks to the state of Michigan for your employer match. The state does utilize a calculation to determine funding. So in this example, say a social worker has $50,000 in student loan debt. The state will take that $50,000 and they will divide it by 8, because you can be in the program for up to 8 years, and they multiply it by 2 because when you are admitted to the state program, you sign a 2-year service agreement. So you're in 2-year contracts with the state. So if you wanted to be in the program for 8 years and were eligible for 8 years, you would essentially apply 4 times and you would have 4 2-year contracts with the state of Michigan to total 8 years. So 50,000 divided by 8 multiplied by 2, $12,500. That would be the maximum award amount that this social worker would receive over the course of 2 years, or $6,250 in year 1, $6,250 in year 2. Again, that's tax-free, but the employer would be required to pay the 20% of $12,500. That's what the employer would be required to contribute over the course of that 2-year contract. So switching over to the National Health Service Corps, again, There are definite similarities between the two programs. This program is also focused on primary care clinicians in full-time outpatient primary care practice. There are some part-time awards that are given in the National Health Service Corps, but it's pretty rare to see clinicians be eligible for those. And just frankly, these programs are so competitive that a provider who's applying for full-time service is definitely going to be more competitive than a provider applying for part-time service. So it's very rare for me these days to see any providers awarded a part-time award. It's full-time. They must work in a HPSA, but this is where a key difference arises, is that HPSA, the federal government, National Health Service Corps, says you must practice in a HPSA. However, you must not only practice in a HPSA, but that HPSA must have a minimum score of a 14 or above in order to be a competitive applicant. So this is the part of the National Health Service Corps where I see a lot of rural providers in Michigan run into a roadblock or run into ineligibility. And that's because, as we saw on the map, a lot of rural Michigan is covered by a HPSA designation. However, much of rural Michigan does not have HPSA scores above a 14. So that means that providers are not eligible. They may be working in a HPSA, but the score is not high enough to make them eligible for the National Health Service Corps. When a provider runs into that scenario and I'm working with them, I always let them know, okay, so the door has closed on the National Health Service Corps, but the great thing is that the door is still open for the Michigan State Loan Repayment Program, because the Michigan State Loan Repayment Program does not care what your score is, or whether your score is below or above a 14. That's not a factor. So that a lot of providers then end up being eligible for the Michigan State Loan Repayment Program, and that's the program in which they ultimately end up seeking funding from. We do have some providers that are in the National Health Service Corps. So it's not to say that there aren't any in Michigan that are in the NHSC, but it is a much, much smaller number. When you look at rural, it is a much smaller number that are participating in the National Health Service Corps than who are participating in the Michigan State Loan Repayment Program. And if you run into a scenario where you have a provider who is eligible for both programs, but they're, maybe they don't have time to submit both applications, or maybe they're just not sure, like, which program do I pursue? I always advise you can apply to both programs. If you're eligible, you can apply to both programs. However, you can only accept funding from one of the programs because both programs receive federal funding in some sort from kind of the same fund. So it'd be double dipping if they receive funding from both programs simultaneously. So it never hurts if you're eligible. It never hurts to apply to both programs, but they just have to know that if they are accepted to both, they're going to have to choose which one they're going to participate in. They cannot participate in both at the same time. Again, must be a U.S. citizen or national, and they can receive up to $25,000 per year or up to $200,000 over the course of 8 years. So I wanted to just pause there. Are there any questions before I move on talking about 3R Net? Are there any questions about either the Michigan State Loan Repayment Program or the National Health Service Corps? Okay, well, if you think of anything, feel free to jump in, or at the end, I'll be available for questions then as well. So we'll move on and start talking about 3R Net. So the National Rural Recruitment and Retention Network, 3R Net for short, is an online job board that is available for employers who have healthcare positions in rural Michigan. So my office, the Michigan Center for Rural Health, we are the Michigan member of 3R Net. Every state has a member of 3RNet, has an organization member, and my office is that for Michigan. And so as such, we offer as a service the ability to post your positions and find candidates for your positions free of charge. So there is no cost for you as an employer to post your positions on 3RNet. And then candidates who are interested in finding positions in rural Michigan or the United States, they register on 3RNet and they job search and they look for positions that are available. The great thing about 3RNet is that they're a nonprofit organization. So it's sometimes you can run into in the workforce world, you can sometimes run into agencies or other organizations that cost a lot of money or don't always have the best business practices. And that's not something that you'll find with 3RNet. They don't sell candidate information. They don't sell employer information. It's all safe, it's all secure. And as our office is the member for Michigan, we make it free for employers that are posting positions in rural. The only positions that are posted on 3RNet for Michigan are located in rural communities and areas of the state. I administer the website, and so I see and approve all job postings before they're posted. And if I see a position posted for Flint or Detroit or Lansing or Grand Rapids or anywhere urban, I do not approve it. We keep it strictly only for positions located in rural areas of the state. So if you have any questions about 3RNet, if you would like to register your organization on there and start posting positions that you have available, feel free to reach out to me. Let me know. I would be happy to set up a call with you or exchange email and get you started. I know that there's quite a few members of TORC that already are 3RNet members, especially the hospitals. But if you aren't, or if you would like to learn more about it and you want to figure out whether or not this could be a good resource for you, feel free to reach out to me. We've found with our NMORC work that, a lot of the, for example, the community mental health agencies weren't utilizing 3RNet. So we were able to onboard them. Some of the local health departments, especially if they're looking for a physician or nurse practitioners or physician assistants, dentists, nurses, social workers. Those are typically the professions that we see candidates. Those are the candidates that we typically see utilizing 3RNet are in those professions. So I'm happy to help you get started with that. So feel free to reach out to me if you have any questions about 3RNet. And then I want to just mention apprenticeship programs and how that might be useful for you as you're working through your work plan and your activities, and then also just in general as you're trying to build your workforce in certain areas. I think, apprenticeship programs obviously are nothing new, especially for certain sectors, so such as manufacturing. They are newer in the healthcare sector. But they are starting to appear, and they are proving to be very useful at helping create a pipeline, helping create a grow your own program, so to speak, because we know how challenging it is, especially in rural communities, how challenging it is to try to attract and bring in outside providers, not from that community. But then in the same breath, you may have really promising students or community members that want to obtain an education and they want to stay and practice and work in your community, but there might not always be those opportunities available. And we know, the research and the data supports that when a student from a rural community has to leave that community to go receive education elsewhere, education and training elsewhere, it's very unlikely and it's very hard to bring them back to that community. So we want to try to look at ways in which we can help someone obtain training, education, and a position in the community in which they already live in. obviously with the hopes of them staying there and working there. So the Michigan Department of Labor and Economic Opportunity, LEO, they offer funding for the development of healthcare apprenticeship programs. And they offer that through a few avenues, one being their Going Pro Talent Fund. I don't know how many of you are familiar with that. I myself, I'll be completely honest, as a state office of rural health, we work obviously very closely with MDHHS and other state departments and other state entities. But working with LEO is not a department that we have traditionally necessarily done a lot of work with. We just kind of this year, we worked on a grant application with them, and we have definitely started expanding that relationship further. And it has, for me, it has just opened up the door to so many other programs and sources of funding that are out there that I never knew existed, and that I know that many of our healthcare partners don't know exist either. And LEO has targeted the healthcare sector along with other sectors like manufacturing and IT and things like that. But healthcare is definitely a sector in which LEO is focused on. They have staff dedicated to it, and they are working very hard to make connections. And they will openly say and will openly admit that they don't have a lot of historical experience in the healthcare sector, and that for them, healthcare is new territory. So they're very adept at working with manufacturing or working with IT or construction or those sectors. That's who they've traditionally partnered with. And now they're getting into the healthcare sector. And so they're looking for partners, and they're looking for ways in which to learn as well. So it's really a perfect time for those of us involved in healthcare to start working with LEO. And also in working with LEO, that involves the Michigan Works agencies. So the Michigan Works agencies receive a lot of funding from the state. And if you aren't already working with your Michigan Works agency, or you aren't familiar with them, I would highly encourage you to have a meeting with them, invite them to some of your consortium meetings, get them involved in any way that you can. The RCORE implementation grant that is in the Eastern Upper Peninsula, their Michigan Works representative from the UP, she is a very active member of their RCORE consortium. And it has been wonderful to have her available because she shares all this information, like the Going Pro Talent Fund, the application cycle, and the funding that's available for creating apprenticeship programs. And she's really very involved in the workforce aspect of that grant. So would highly encourage you to get in touch with them if you have not already. And I am seeing apprenticeship programs developing for medical assistants. So that's something that across the state, I am constantly being told that there is a shortage of medical assistants. So I'm sure that some of you are experiencing that as well. We just had a hospital in the Upper Peninsula last week be approved by the U.S. Department of Labor as a registered apprenticeship. So they are starting and using Going Pro Talent funds to start a medical assistant apprenticeship program at their hospital. And they are going to get that up and running in January. So even despite of COVID and the absolute craziness that this past year has brought and has been, we had a meeting about this, and I think it was in October, and they made their model, they replicated it after a model of a federally qualified health center. So an FQHC in Battle Creek started a medical assistant apprenticeship program. And I connected the FQHC and the hospital with one another. They had meetings and discussions and learned from one another. And the hospital said, you know what, we're going to do this. Like, we have to do this. We have to create our own pipeline. We have to grow our own, or else we're not going to have enough. We already don't have enough, but we're not going to, this is the only way we're going to help solve this problem. And so they are ready to run in January. So once you decide to do this, I mean, of course, there's a lot of things that have to be in line, but it can happen really quick. And very, very fast compared to other projects. So I would highly encourage you to think about it. You know, a good place to start would be speaking with the folks at Michigan Works, learning more about them and about their funding that's available. You can always speak with the folks at Leo as well. And if you need help in getting connected with anyone, feel free to reach out to me. I'm happy to do what I can to get you connected to the appropriate folks. I can, obviously this is being done for medical assistants. I can absolutely see something similar being done for peer recovery coaches or peer recovery specialists. I know those are in high demand and needed as well. You know, obviously an apprenticeship program is not going to work for every profession. It doesn't work for physicians. It doesn't work for, you know, nurse practitioners or dentists. But it does work for some of the positions in which you need to fill and some of the positions in which you need to fill really quickly. So would highly recommend you to spend some time in 2021 examining this idea and seeing if it's something viable for your organization and something that you might be able to do. And then these are just a few of the resources that I mentioned, their websites. You know, again, if you have any questions after this presentation or just any questions about anything at all, it doesn't even have to be workforce related, but if it's, you know, rural health related, feel free to reach out to me. And if I don't know the answer, I would be happy to find it for you, or happy to get you in touch with one of my coworkers who would be able to help you as well. So I'm always available via email or via phone call. And just get in touch. I would love to hear from you and help you in any way that I can. So thank you so much. Are there any questions before we conclude?
Rachel, I don't really have a question so much as I just want to say thank you for taking the time out to present to us. The apprenticeship program was not something that I was aware of, and I was texting some of the members of the TORC team during it because we're all really excited. That sounds awesome. So yeah. I'll probably get with you later to try to get some contacts from Michigan Works and Leo, if that's okay with you.
Yeah, okay. That's fantastic. Awesome. Yes, the unfortunate part of just the timing, the way that this has worked out is that the Going Pro Talent Fund, the application actually ended on November 30th. so that it's usually every fall, and it's usually in November is their application, but with the caveat that that's just the Going Pro Talent Fund. There are other funding sources available and out there, either through the state of Michigan or through the US Department of Labor. So, you know, not trying to discourage you at all. You definitely need to get in touch with Michigan Works and with Leo and to learn more about their programs and their services and their funding that they have available. You know, they do have money available, and they do want to focus on the healthcare sector because it's such a huge sector of employment for so many people in Michigan. Obviously across the United States as well, but really in Michigan, it's a huge sector of employment. So they are available to help. And, you know, it would certainly not, you know, we're at the end of the year. It certainly would not at all hurt to, in January, start having some conversations with them about how do you build a program? What does a program look like? And just learn the terminology as well. You know, for those of us in healthcare, you know, we're used to our acronyms and we're used to our specific terminology as it relates to healthcare. They have their own, you know, acronyms and vernacular as it relates to workforce development and apprenticeship programs. And so there's a little bit of a learning curve on that. So that I'm still learning and that that I am by no means an expert on. So I would definitely think that it would be great for you guys as a consortium to connect with them in some way. And, the easiest way would be through your Michigan Works region, a Michigan Works agency that covers your region. They would be a good place to start, and as well as with Leo. So Ashlyn, feel free to get in touch with me and we can talk more about that and work through that. I'd be happy to help with that.
Awesome. Thank you.
All right. Are there any other questions or comments? Oh, is there something in the chat? Let's see. No, very informative. Well, thank you. Well, thank you so much, everyone, for your time today, for joining us. Ashlyn has the slides, so she can send those out to you. Feel free to take a look at those and share those as you see appropriate. We will get the recording over to you. And again, if you have any questions, feel free to reach out to me. I would love to be able to assist and help you in any way I can. So thank you so much for your time. Have a good day.